Jim Love finds joy in connecting with others. One of the ways he does that is through writing and performing poetry.
This piece is called My Pet Thesaurus Died. When the specialist, a psychologist of some renown, asked me, "What is the one thing that your mental illness has taken from you that you miss the most?" I couldn't find the words to answer. I don't know why, I just started to cry. What's the word? Tears. Yes, tears. This wasn't a drop. Just being able to express some of those things is healing. Sharing it with an audience sometimes is healing because you can make that connection. The same as telling our story is you can find that one person out in the audience who nods along going, "I understand that." And maybe they approach you afterwards going like, I went through something similar. Can I tell you my story? And you go, yes. So those are the types of things that really help.
Jim, who lives in Kannapolis, is a storyteller with Mental Health America. And he's the first to acknowledge that his mental health struggle continues. It's a struggle so many of us face, but it's one we don't have to go alone. On this episode of Did Y'all Hear? We'll detail how Cabarrus is building an environment of accessibility for behavioral health issues, from the creation of the county's behavioral health department to the upcoming Regional Behavioral Health Center. We're opening doors to wellness.
Actually, since COVID came along, people have been paying more attention to mental health. One of the problems that we have had is access. And with getting a behavioral health center here in the county, another resource, it's just invaluable. That access, once you're able to tell your story, once you're able to be honest about your situation, then it's where's the next step? And now we're going to have that next step more readily available for people. And that is something you can't put a price on.
Cabarrus County's Regional Behavioral Health Center is scheduled to open in the spring of 2026. That year will mark a full decade since commissioners formed the Mental Health Advisory Board. That group, with members from school systems, local governments, public safety and health organizations, and more, was charged with evaluating local mental health resources and promoting awareness. A variety of initiatives followed. Mental health first aid training was held for the county and partner organizations. The Opioid Response Project put a spotlight on the devastation of addiction. The Stepping Up program delivered resources to inmates at the Cabarrus County Detention Center. Through the work of the advisory board, other needs came into focus. Here's Cabarrus County Commissioner Steve Morris.
It doesn't take a lot of time being involved in those conversations to quickly realize what a pressing need it is in our community, and one that we need to address as seriously as possible. Hearing people from Cabarrus County and other places talking about experiencing a mental health emergency, particularly with their children or a family member. And we have very limited resources as places for them to go if it's beyond something they can handle on their own. So there was nowhere that they could take a family member that would receive the type of care that they needed for that emergency situation. And so that's where I learned of the importance, in my mind, of trying to create an alternative for people in Cabarrus County. The light bulbs actually began to come on for me at a legislative conference that I attended in D.C. It's been a number of years ago now, but was meeting with other counties across the country that had taken various steps to address needs in their community. And one of the counties talked about the experience that they had had with a behavioral health urgent care facility, which very specifically dealt with folks that were having a mental health emergency and how they dealt with those situations, and talked about the center that they had created and the services that they provided there. Also talked about emergency response that they had for some folks. And I was particularly impressed with the explanation of many of these patients that they were involved with were people that did have a mental health issue and were being treated by medication. And frequently, they would come off of that medication. They would experience a crisis situation. They would call out the crisis response team. They were able to talk through those issues, get those folks back on their medication, and usually when they checked back in with them the following morning, everything was fine. So it made a real positive impact on those individuals and on their families.
Armed with knowledge that a center could create lasting change in the community, county officials began to seek funding. Senator Paul Newton and Representative Kristen Baker helped to secure $32.5 million in state funding for the facility. The county hired Human Experience to design a building that could meet current and future needs. Albemarle-based Monarch was named as operator. As development began, the scope of the center transformed.
As we have engaged some really qualified professionals to help us in this process, they have come up with a plan that I think is much better than what we might have initially talked about. And so I think that we've, through refining that process and going through that planning, that we are creating a facility that's going to offer a lot more. That parent with that child that needs to be transported to a facility outside the community, we now will have the capability to accommodate them. Those children that have been, some of them in the emergency room, you hear horror stories for weeks until they could find a facility available. We now have an option for them. So by engaging professionals to help us in that process and looking at different models, I think we've come up with one that is much more flexible than we might have originally imagined. We've heard presentations from the firm that has been engaged to operate that facility.
Here's Monarch's president and CEO, Dr. Peggy Terhune, speaking to commissioners at a meeting in June 2023.
So what makes Monarch different from other companies, I would say, is our values. We believe that everyone has a right to achieve their unique potential. We believe that it's your job to tell us what you want your life to be, and it's our job to help you figure that out and get there. And so our values are incredibly important to us, and I'm going to spend a little time on them because that's what makes us different. The first one is integrity. We believe in being honest, open, and ethical. So given that this is a facility that is owned by Cabarrus County, we believe that you have access to everything we have access to. It's your tax dollars that would be providing the services in the facility via Medicaid dollars and other ways that you pay your taxes to the state. And so we believe that it's really important to be open and honest and let you see anything and everything that we see. Compassion is probably one of the most significant values. It's the reason most of our staff work for us. We don't pay a whole lot of money. We're not, a rich company. We're a private nonprofit. People will inevitably tell you, why do you work for Monarch? Because I love the people we work with and because I'm treated with respect. We believe compassion is important not only for the people we work with, but for our employees, for their families, and for the communities at large. Respect, obviously, is the next one. Excellence is the third one. We follow multiple evidence-based practices. Monarch is the company that has brought multiple new options for services. We are continually going out and are members of best practice communities where we're sure that what we're doing is evidence-based, meaning research has occurred and it's been published, but also that it works. Courage is another one, and we put that one in there because we want our staff to know that it's okay to make mistakes. Because if you think about it, that's how we all learn. Courage also to risk, and this is a risk for us. It's a big project, but we think that we're up to the challenge and can handle this. And then the last one is innovation. So we believe in doing things differently.
As plans took shape, it became clear that a full continuum of care would serve the community best. Here's Dr. Elise Pugh. She came to Cabarrus as the first behavioral health director before being promoted to assistant county manager.
It is imperative for communities to have a full array of crisis services. And so this particular regional behavioral health center is going to have BHUC, which is the behavioral health urgent care, which, as you know, it's not a service that you would stay overnight at, right? Just like when you go to a medical urgent care, it's an acute issue. You go in to get it treated and for stabilization, and then you leave. Same thing for behavioral health urgent care. So a person would only stay in a behavioral health urgent care by the service definition for up to 23 hours and 59 minutes. But what's good about the regional facility is that it will also have a facility-based crisis center attached to it. So if someone comes in through the behavioral health urgent care and for whatever reason they actually do need further stabilization, they will easily be able to transition over to the facility-based crisis, which is, would provide an opportunity for someone to stay overnight if necessary. The other components of the regional behavioral health center is, well, one, it's for children and adults, right? So there's services for children and adults under one umbrella, which is wonderful. And there's also going to be a psychiatric residential treatment facility. And so we know, and this is not unique to Cabarrus. It's not unique to the counties surrounding Cabarrus, but there is a severe issue right now in the state of North Carolina in terms of getting children access to PRTF services when needed. There's just so many kids. I don't have, the specific number off the top of my head, but I do know that the state is starting to track this data around the number of children who have been recommended for PRTF but are unable to access that service. So when our facility opens, I can only imagine that this is really going to be something that will serve, again, not just children and youth in Cabarrus County, but in surrounding counties as well.
To support the center and strengthen collaboration, the county needed an in-house resource. That came in the form of a behavioral health department. Here's Department Director, Dr. Camila McKissick.
The number one goal is for every resident of Cabarrus County to have access to behavioral health care in whatever shape or form that they need. That is Cabarrus County's goal, and that is the Behavioral Health Department's goal. So as we look at the different things that we're involved in, it's really to that end. My focus is to really be reaching out to the community, looking at what current resources are available, how we can enhance those resources, how we can make sure those resources are what our community needs, and how we can continue to move the needle to make sure that the resources that we have available are accessible to all of our residents. We work really closely with community agencies. We work really closely with the Cabarrus Health Alliance, with the Stepping Up program. We also work closely with a mental health advisory board, and with various providers like Daymark Recovery Services. We work very closely with them as well. We work closely with Monarch, who's going to be the operator for the Regional Behavioral Health Center, and we work really closely with Partners, our managed care organization. So many of our residents within the Department of Human Services have Partners managed care organization health insurance, and so we do a lot of work one-on-one with them to ensure that they know the needs of our residents and our customers and are able to meet those needs. And so our collaborators, I would say, are largely really anyone in the community who is serving our residents in the behavioral health space. I want the work to reach the people that it needs to reach and to be shaped and molded by the people who need it the most.
Cabarrus County has identified the gaps, particularly in crisis services in our community, and is proactively addressing them through funding, through resources, and through supporting other services that are currently available in our community, for instance, through the Cabarrus Health Alliance. And so much of the ARP funding that we had also was devoted to behavioral health services and mental health services. So at this juncture, the county is doing a lot to address the gaps that they identified in our community. And again, long term or even medium term, we will be able to feel the change.
For residents like Jim Love, that change means everything.
Having that available in a community, I can't tell you how important that is. We look at the rising rates of suicide, deaths of despair, drug addiction, those types of things. So much of that goes back to mental health. In this country right now, the number one program, and I use that word in quotes, that deals with people with mental health issues is our judicial system. People are in jails who should be in hospitals. People have committed crimes that if they could have gotten the help they needed earlier would never have even occurred. So seeing Cabarrus County step up and make mental health a priority is, I don't think people can imagine the benefits that this could pay off for our community. Just from mitigating human suffering in a very real way.
Remember, if you or a loved one is struggling with a mental health crisis, free confidential help is available 24/7. Trained crisis counselors can be reached at the Suicide and Crisis Lifeline by calling or texting 988 or 1-800-273-8255. Now, here's the full version of My Pet Thesaurus Died.
When the specialist, a psychologist of some renown, asked me, "What is the one thing that your mental illness has taken from you that you miss the most?" I couldn't find the words to answer. I don't know why, I just started to cry. What's the word? Tears. Yes, tears. This wasn't a drop rolling cinematically down my cheek. This was sobbing, snot bubble popping out of my nose. Ain't got no tissues. I'll bury my face in my sleeves sobbing. Does that even make sense? There has to be better words for tears this intense. The wail of the mourner is the first shower full of dirt. Shower? Shower? No, it's a shovel. It's a shovel. The wail of the mourner as the first shovel of dirt hits the coffee lid. Coffee lid? No, it's a coffin lid. Maybe it is coffee. No, coffee lid is Starbucks. Wait, Starbucks was a sci-fi hero, an intergalactic fighter pilot who fought robots, or was he that guy in the whale book? You know, the one, the peg-leg captain obsessed with a white whale? A white whale? A white whale? I'm chasing my own white whale as I try to tell the simple tale of whaling in an office. You see, mental illness has cracked open my skull, and with rusty hacksaw blades, plastic sporks, it has gouged out that which was truly mine, that which was fully me. It has taken my memories, it has taken my words, it has taken everything. A part of me is now dead, killed by chemicals and convulsions. My vocabulary consists mostly of ahs and ums. Sometimes I manage a sentence that a second grader would scrawl out with a giant pencil on newsprint paper in search of a gold star. Am I speaking in tongues? Not the holy kind, just a scream of syllables lacking sense or sensibility. And more, my favorite verses are now a jumble of nonsensical sentiment. Tomorrow and tomorrow and tomorrow creeps in the women speaking of Michelangelo, because life is a broken-winged bird, still I rise. That's not right. That's not right. That's not right. I can't write. The cursor blinks its curses, the pencil lead breaks, the words gather into the ether. This is the new me, a me I don't want to be. So when the psychologist asks me the question, what do I miss most? I cry. I just cry because I don't have the words.